Today we will discuss COVID-19, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. COVID-19 is a contagious illness caused by a virus called SARS-CoV-2. In everyday terms, it's a germ that spreads mainly through the air when people cough, sneeze, talk, or even breathe. It mostly affects your nose, throat, and lungs. Some people get mild cold-like symptoms, while others can get very sick. Common symptoms. People often describe it like a mix of a cold, flu, or bad respiratory infection. Fever or chills. Cough. Sore throat. Runny or stuffy nose. Body aches or fatigue. Headache. Loss of taste or smell, and it is less common now but still possible. Shortness of breath, which is a more serious sign. How to know if you have it. 1. Pay attention to symptoms. If you suddenly feel sick, especially with fever and cough or fatigue, COVID could be the cause. 2. Take a test, most reliable way. At-home rapid test, quick results in 15 minutes. PCR test, lab test, more accurate, takes longer. If the test is positive, you likely have COVID. 3. Think about exposure. Ask yourself, have you been around someone who was sick recently? Were you in crowded indoor spaces? When to seek medical care. Go to urgent care or the ER if you have trouble breathing, chest pain, confusion, lips or face turning bluish, symptoms getting worse instead of better. Simple way to think about it. COVID is contagious respiratory virus. Feels like cold/flu or even sometimes worse. Best way to confirm, take a test. If someone has COVID-19. 1. Stay home. Don't go to work, school, or public places. Try to stay in one room away from others if possible. 2. Avoid spreading it. Wear a mask if you're around people. Don't share food, drinks, or utensils. Wash your hands often. 3. Rest and take care of yourself. Drink lots of fluids such as water, tea, and soup. Get plenty of rest. Use basic meds like acetaminophen or ibuprofen for fever and body aches if safe for you. 4. Test and monitor. Take a COVID test to confirm. Keep an eye on symptoms, especially breathing. 5. Stay home until better. Stay home at least 24 hours after fever is gone without meds, and until symptoms are improving. 6. Get help if it gets serious. Call a doctor or go to the ER if there's trouble breathing, chest pain, confusion, symptoms getting worse. When someone is really sick with COVID-19, a hospital focuses on keeping them breathing, stable, and helping their body fight the virus. 1. Help them breathe. Give oxygen through a mask or nose tube. If that's not enough, use a machine such as a ventilator to breathe for them. This is the most important step, because COVID mainly affects the lungs. 2. Give medications. Doctors may give antiviral drugs to fight the virus, steroids to reduce lung inflammation, medicines to prevent blood clots. 3. Support the body. 4. Fluids through a vein. Control fever and pain. Help with nutrition if they can't eat. 4. Constant monitoring. Check oxygen levels, heart rate, blood pressure. Run blood tests and scans. Adjust treatment quickly if things change. 5. Special positioning. Sometimes patients are placed on their stomach, aka proning. This helps oxygen get into the lungs better. 6. Treat complications. If problems happen, they act fast. Pneumonia warrants stronger treatment. Blood clots warrant blood thinners. Organ problems warrant extra support like dialysis for kidneys. Simple way to think about it. Hospitals don't just cure COVID instantly, they support the body while it heals. Help breathing. Reduce inflammation. Prevent complications. Monitor closely. Common medications for treating COVID-19 include 1. Antivirals to fight the virus. Remdesivir. Helps slow down the virus. Usually given through and for in the hospital. 2. Steroids to calm lung inflammation. Dexamethasone. One of the most important drugs for severe cases. Helps reduce swelling in the lungs so breathing improves. 3. Blood thinners to prevent clots. Heparin. Enoxaparin. COVID can cause dangerous blood clots. These help prevent them. 4. Immune system calming drugs for severe cases. Tocilizumab. Baricitinib. Used when the immune system is overreacting. Helps reduce severe inflammation. 5. Supportive meds for symptom relief. Acetaminophen for fever. 4. Fluids for dehydration. Oxygen. In simple terms, anyone can catch COVID-19, but some people are more likely to get very sick from it. Here is a list below. Older adults. People over 65. The body's defenses aren't as strong, so infections hit harder. People with lung or breathing problems. Asthma, chronic bronchitis, etc. Their lungs are already weaker, and COVID targets the lungs. People with heart problems. Heart disease, high blood pressure. Their body has a harder time handling stress from illness. People who are overweight. Especially significantly overweight. Makes breathing harder and increases inflammation. People with diabetes. Blood sugar problems. The body doesn't fight infections as well. People with weak immune systems. Cancer treatment, organ transplants, or certain illnesses. Their body can't fight the virus effectively. Smokers. Current or long-term smokers. Their lungs are already damaged. Pregnant people. The body is under extra stress and changes during pregnancy.